If your back is constantly hurting or it feels like it isn't going anywhere after you've tried stretching, icing, or even just giving it a lot of rest, there might be a mismatch between your brain and the muscles in your back. So in this video, we're going to go over 3 simple exercises I would do to start calming down your back pain and help rebuild the brain-back connection so you can get going and doing the things that you really want to do free of pain. By the way, I'm Mike. I'm a chiropractor and a master's of science in exercise, and all I do every day is help people get out of back pain, knee pain, and hip pain. So let's get started. Now, just before we jump into these exercises, here's a quick disclaimer. Now, if the back pain that you've been dealing with is more concentrated in the lower part of your back, especially kind of from below our ribs all the way down to our pelvis, and even sometimes into the back of the pelvis or kind of the sacrum region, that's this tailbone area, okay? What we can often figure from that is there is often a mismatch in the firing of the muscles that connect the vertebrae, and then that translates to the bigger muscles, the ones that we can feel that kind of run like this over our back. They start to tense up. That's where we get muscle spasms, and all that is a protective mechanism against further damage. So what this means is that we can understand that if we can get the muscles firing properly and actually get the back and the spine working in a way that it feels safe and it feels controlled, the solution to making sure that we don't get consistent recurring back pain is to keep moving and building up our strength in this area so that we aren't regressing and kind of communicating to our back and to our brain that it's not safe to move. Basically, to continue to feel safe to move, we need to keep moving and doing things that lets our brain know that it's okay to move. Hopefully that makes sense. All right, so if we have that pain in this kind of part of our low back and we want to address it, the first thing we want to do is actually do a breathing exercise, okay? So what I want us to envision is our core or our back, all right, kind of all through here is like a big soda can, okay? There's a soda can in our core, okay? And so when we breathe in, we are going to envision the soda can expanding. So we're gonna expand our core down to the floor and our core up to our chin, okay? And then when we breathe out, when we exhale, we're going to try and keep that soda can from compressing, okay? We don't want to squeeze it out like that. We want to exhale while bracing that part of our back. And what that does is that activates those little muscles that are often the source of the pain that we're feeling. And we want to do that so that we can tell the brain that those muscles are safe to move in a controlled manner, okay? So what we're going to do is we're going to breathe in for about 5 seconds. Remember, expand. And then when we breathe out, we're going to brace and keep that soda can from compressing, okay? So just like this. All right, so we can do that anywhere from 7 to 10 times. Make sure that we don't breathe in and breathe out for too long, or else we can maybe start to feel a bit lightheaded. And that is the breathing in, bracing exercise. All right, so the next exercise we're going to do is also going to activate and incorporate our core, which corresponds with our low back and those little muscles I was talking about. We're gonna do an exercise called the bird dog exercise, okay? Basically what this is we're going to go on all fours, okay? Just like this, we're gonna have a straight back. So we're not gonna bend, we're not gonna be angled like this, okay? We're gonna have as straight a back as possible on all fours. And then what we're going to do is we're going to take our left hand and draw it out like that. And then at the same time, we're going to kick back our opposite leg, okay? We're going to do our best to not shimmy or shake this direction, okay? We're going to do it at this opposite time like this. Out, and then slowly come back in and touch. and then put them down, okay? Go out like this. Nice and stable, nice and controlled. Touch, and back in like that, okay? We want to make sure that we stay breathing throughout all of that. We want to make sure that we are controlled. So if we can't do opposite arm, opposite leg at the same time, we could then do it just the arm and just the leg as far as we can go, then bring them back. We can do them separately. That's kind of the pre-step if we can't do it together at the same time, okay? We can do that 8 to 10 times, that's one set. Do it another 8 to 10 times, that's a second set. I would recommend doing that morning and then in the evening. And that is the bird dog exercise. All right, for this exercise, what we're going to do is we're going to open up some of the joint spaces, both in our lower back as well as in the hips, okay? We're going to do a nice gentle stretch, and there's a little bit of strengthening in this exercise as well. So what we're going to do first is we are going to get onto our back, okay? And then once we're on our back, we are going to bring the painful hip up to our chest, okay? So we're gonna grab our knee as best as we can. If you have to grab down lower because you can't reach this far, that's totally okay. We're going to bring it up until we feel a stretch kind of in the back here. So I can do it on this side so y'all can see. Just on this side right here, okay? So you might feel a stretch at that point. The next progression of this is we would bring both knees up to our chest, okay? And then what we're going to do is lightly, so we don't fall off our table or our chair, just rock back and forth, kind of like this, okay? That's just introducing gentle motion, especially into the lower back, which can often contribute to some of the hip pain that we're feeling. So if we want to go further, we can. Just make sure we're stable. So we're just going back and forth like that, okay? All right, so hopefully those exercises gave you some relief. What we want to look for is if our pain at the start was like a 6 or 7 out of 10, 10 being the worst pain we've ever felt, 0 being absolutely no pain, we want to see that possibly reduce down to a 4 or a 3. If it didn't get any worse, but it also didn't get any better, then that's okay. What we've done is we've started the process of re-strengthening our joints and our lower back, especially to help recover and let our body know that it is safe to move, all right? If you notice that it was causing the pain that we are currently feeling, we don't ever want to push through the pain. So if you're doing the exercise and it pushes up to that 6 or 7 out of 10 that maybe we're feeling, we don't want it to get any worse than that. So that would be a good sign that maybe today is not the day to be doing these exercises. We can maybe try again next time. If it gets immediately worse and it's horrible pain, obviously that's where you go and see your trusted health professional, okay? Or if the pain changes in any sort of way, that's another warning sign. But hopefully for the majority of you that try this, you get some relief, get some motion, and you begin to feel strong and capable in your body again. So if you enjoyed this video and you would like to see more, feel free to subscribe down at the button below. I also have my back pain playlist for more exercises that can help build up strength to combat back pain. If you want to work one-on-one, you can reach out to me. We take both coaching clients and clinical care at my clinic in Southern Utah. And so hope to see you in the next video, and remember to always stay active. Thanks.